Hello learners. Till now we have discussed mechanism of probiotics, mainly immune modulation, interference with quorum sensing signaling, and further we have studied antipathogenic activity of probiotics and role of probiotics in urogenital health and anti-diabetic activity of probiotics. Now to move further, we will discuss further health benefits of probiotics. So the next activity exhibited by probiotic microbe is anti-inflammatory activity. Inflammatory bowel disease is being associated with impaired production of short-chain fatty acids, particularly acetate, butyrate and propionate. Moreover, these short-chain fatty acids have been shown to play a key role in maintaining colonic homeostasis. Probiotics also possess anti-inflammatory effects and improve the propulsive colonic function. Therefore, it is reasonable to consider that supplementation with indigestible carbohydrates and fibers alone or in combination with probiotics to increase the production of short-chain fatty acid could be useful in therapeutic approaches. Next activity is anti-cancer activity. In vitro studies have demonstrated that probiotic strain like Lactobacillus fermentum, NCIMB 5221 and 8829 are highly potent in suppressing colorectal cancer cells and promoting normal epithelial colon cell growth through the production of short-chain fatty acids, specifically ferulic acid. Again, two different probiotic strains like Lactobacillus acidophilus LA102, Lactobacillus KZ LC232 have also been found to show pronounced cytotoxic activities with in vitro anti-proliferative activity against two colorectal cancer cell lines. The next activity is anti-allergic activity. In vitro studies of certain probiotics such as Lactobacillus plantarum L67 have shown the potential to prevent allergic associated disorders with the production of interleukin 12 and interferon gamma in their host. Next activity is angiogenic activity of probiotics. Angiogenesis has been an important phenomena and is necessary for wound healing process. The angiogenic process consists of series of cellular events by which new vessels arise from pre-existing ones by promoting recruitment of inflammatory cells and producing cytokines, matrix degrading enzymes and chemokines. Deregulated angiogenesis has a prominent impact on major human diseases such as cancer, diabetic retinopathy and IDP including CD and UC. Non-pathogenic probiotic yeast like Saccharomyces boulardii has been reported to protect against intestinal injury and inflammation. The potential mechanisms of probiotics in angiogenesis process may include alteration of inflammatory cytokine profiles, downregulation of pro-inflammatory cascades, or induction of regulatory mechanism in a strain-specific manner, epithelial barrier function enhancement, visceral hypersensitivity reduction, spinal afferent traffic and stress response. Probiotics plays a significant role in inducing intestinal angiogenesis by vascular endothelial growth factor receptor signaling that in turn regulates acute and chronic inflammation in intestinal mucosal tissue caused by progression of inflammatory bowel disease. The last activity is nothing but the effect of probiotics on brain and central nervous system. The colonization of microbiota in gastrointestinal tract is well associated with both gastrointestinal system and gastrointestinal diseases. The microbiota gut-brain axis is an interactive bidirectional communication established by the exchange of regulatory signals between GI tract and central nervous system. The effect of probiotic on CNS has been mainly studied in clinical trials where it has been evident that gut microbiota influence human brain development function. In children with autism spectrum disorder, a daily dose of Lactobacillus plantarum led to an improvement in their school records and attitude towards food. A decrease in anxiety symptoms by administration of Lactobacillus casei strain to the patient suffering from chronic fatigue syndrome is observed. However, despite an increase in Lactobacillus and Bifidobacteria levels, the bowel function were not studied. Hence, it is feasible that the reduced anxiety was due to improved bowel function. The last criteria and the last property of probiotic is anti-obesity activity. Abnormal or excessive fat, nothing but obesity, accumulation that directly impairs health is linked to an increase in energy availability and a greater control of ambient temperature, leading to an imbalance in the energy intake and expenditure. Probiotic strain like Lactobacillus gasseri have shown properties of inhibiting the increase in adipocyte tissues that are the main source of leptin and adiponectin tissue, and thereby limiting leptin secretion. Other probiotic microbes such as Lactobacillus casei, Lactobacillus acidophilus and Bifidobacterium longum have also been reported to have hypercholesterolemic effect. Apart from previously explained effects, probiotics are also used in treatment and prevention of various medical conditions like antibiotic associated diarrhea, probiotics and Clostridium difficile infection, probiotics and Helicobacter pylori infection, probiotics and acute pancreatitis, probiotics and necrotizing enterocolitis, probiotics and multi-organ dysfunction syndrome, probiotics and ventilator associated pneumonia. So friends, in this module we have seen anti-inflammatory activity, anti-cancer activity, anti-allergic activity, anti-angiogenesis activity of probiotics, effect of probiotics on brain and central nervous system. Along with that, we have seen anti-obesity effect of probiotics. Apart from that, we have also seen in brief probiotics which are also used in treatment and prevention of various medical conditions like antibiotic associated diarrhea, Clostridium difficile infection, Helicobacter pylori infection, acute pancreatitis, necrotizing enterocolitis infection, multi-organ dysfunction syndrome and ventilator associated pneumonia. To summarize this module, we have focused on basic mechanisms of action of probiotics, namely enhancement of epithelial barrier, increased adhesion to intestinal mucosa, inhibition of pathogen adhesion, competitive exclusion of pathogenic microorganisms, production of antimicrobial substances, modulation of immune system. Later on, we have discussed all these mechanisms in detail with respect to activities such as antipathogenic activity, urogenital health care, anti-diabetic activity of probiotics, anti-inflammatory activity of probiotics, anti-cancer, anti-allergic activity, angiogenic activity of probiotics, and lastly we have seen the effect of probiotics on brain and central nervous system. Thank you.